Good morning.
Morning, Mark. My name is Niraj, one of the consultant ophthalmologists here at
Hi,
Cathedral Eye
Niraj.
Clinic.
Lovely to meet you.
Just so we'll start with a few questions.
No.
Okay, fine. Do you mind if I have a look at the eye?
Of course,
You
no
just pop
problem.
those glasses off.
Take those off. Maybe I'll not be needing these.
Issues of dry eye.
A little.
So, what I would usually very briefly go through is the options. There's two windows at the front of the eye. The first window is your cornea. The second window in the eye is the lens.
Yes.
And all the light coming into your eye are focused at the first window, then the second window, to the back of the eye, to the brain we see. So you can alter and change any prescription, pretty much, or most prescriptions for the vast majority of patients, by operating on either the first window or the second window.
Okay.
The first window is done with a laser, less invasive, but not entirely permanent. And the second option is a lens replacement surgery where we remove your current lens, which will eventually turn into a cataract in nearly everyone eventually. And we put a synthetic lens, brand new lens, in the place of your original lens, and that's essentially a permanent procedure. So
Right.
those are the two approaches
Two
for
options.
refractive surgery to get patients out of glasses.
Tell me a few things that might concern people about laser eye surgery. Possibly one of the things, I have recently got my bus pass, and I know a lot of people have said, "Oh, you're too old to get laser surgery." Is there any truth in that?
Generally speaking, there are two universal changes that come with age to every human being. Okay.
Tell me about it.
The first change is something called presbyopia. So every human being around the age of 40, you'll see them doing this with their phone as the months and years go on.
Yep.
Right? And then they'll go out and buy a pair of reading glasses in addition to their distance glasses. That's the general natural process that we all go through. Typically up into the age of even beyond our 50s, we are candidates for laser surgery, where essentially it's a type of what we call monovision. One eye is lasered to prioritize the distance vision, usually the dominant eye, which is usually the right eye, and one eye is lasered to prioritize predominantly the near vision.
Is that a bit like the concept of the bifocal contact lenses?
Correct.
Where
With the modern lasers, what we do now is something a little bit more sophisticated, where we will use the laser and change the shape in such a way that it's a blend.
Yes.
So one eye is not just distance, there's a bit of distance and a bit of depth coming up to intermediate. And the other eye is not just near, it's a bit of near giving a depth to the intermediate. So you get what's called laser blended vision. What happens when we get a little bit older, after our 60, 70, 80-year-old, this is when the lens goes through the second change where it becomes opaque. And this is called a cataract.
Yes.
And in those cases, what we simply do is a lens replacement surgery, where we go, it's a little bit more invasive, we go in the eye and we will offer you either a full multifocal lens, that gives you the full range of vision, distance, intermediate and near, with both eyes in action. Or we can offer you what's called an extended depth of focus lens, which prioritizes distance and intermediate, but not quite as much near. But
Yes.
the night vision is a bit better.
What about other health concerns people might have, perhaps if they have astigmatism?
So with modern laser and for lens surgery for quite some time now, there is pretty much no level of astigmatism that can't be corrected.
I have a very low pain threshold. Talk to me about the level of pain I will experience if I go ahead with the procedure.
What I can confidently say is that laser surgery is essentially a painless procedure, okay? And this is demonstrated in how verbal I need to be during the laser procedure, because the patient isn't feeling anything.
Yes.
So I need to tell them not what I'm doing, but what they're going to experience, because otherwise they wouldn't know. And essentially what I will say to them in my mini spiel is, we will bring you in, lie you down, We will do one eye at a time. I'll get you in the exact right position. Okay, we'll close one eye. We'll put a little eyelash support in the other eye. You're lying down, and all you will do and all you will see is a little green blinking dot. And all you do is focus all of the attention on that one green dot. And the moment you are focused on the green dot and the green dot is focused on you, you won't feel anything. That means the laser is now turned on.
Okay.
So it's a cue. I have to tell them because they won't know.
Yeah.
You hold still for 9 seconds. After 9
That's
seconds, the hard part's done.
Wow.
That's it.
That's
I do the
amazing.
same thing on the other side. Okay, 9 seconds, whether you're having what's called smile surgery or LASIK. Okay, that's the hard part done. The rest of the surgery is very, very routine.
My God, that sounds so straightforward. So I take it the thought that a lot of people would have is, oh, I have to take weeks off work after this surgery. What's the recovery time? How do you feel after the surgery for a few days or weeks?
For laser surgery, many of our patients go back to work the next day. We tell them at least take a day or two off.
Yes.
But especially for the most modern version of laser refractive surgery, which is called SMILE, which is some people as referred to as keyhole LASIK. So we're all familiar with LASIK, most common elective surgery in the world. SMILE is the evolution from that, where we're doing the same correction, but we're not making a flap on the cornea. And that's possible because of the lasers that we have.
Okay.
So essentially no moving parts on the eye. Okay.
Yes.
You're dealing with just one single keyhole incision. And what will happen is immediately after the surgery, even if you have a very big prescription, you'll notice the difference sitting up on the table. And we've had patients in tears on the table as soon as they wake up because they can see the clock immediately where they couldn't see before just a couple of minutes ago. And then they will go home, things will be a bit misty, bit watery, and then by day one, nearly every single patient is at least within driving standard of vision, and they're free to basically do all the normal activities that they do, especially if it's computer work, using their phone, reading documents.
Other normal activities, going on holiday. The word in the playground is that you cannot fly after laser surgery. Is that a thing?
You can fly. You can fly.
Good.
The only caveat to that, and the only thing I tell our patients is, obviously we'll check you at day one and week one. Okay, that's important. But the planes that we fly on, the cabins are bone dry, the air. There's no moisture. And therefore the eyes, especially during the healing process, can get very dry. So all I say is take a lubricant with you, keep it in your pocket, and every 10 minutes even, just wet the eye, unless you're sleeping.
We very chat about the sordid topic of coin whenever we're talking about how much these things cost. Obviously, I'm not looking at price particularly, but in comparison to the amount of money that I would be spending on disposable contact lenses over the years, how does that all pan out?
I think I would, just to give you, to kind of put it as a simple example, to put it in context. Typically in the UK, we spend about 30 to 50 pounds per month on daily contact lenses, depending on the brand or the particular prescription.
That sounds right.
And that is essentially what you, on a finance plan, not encouraging you to get finance, but on a finance plan, that is how much you would be paying per month to pay off the laser.
Yeah, and then that comes to an end, whereas the payment for the contact lenses do not.
100%. So if you could afford contact lenses, you could afford lasers.
This,
The other big one I get, which is a kind of a carry on from the safety, from the cost, is the safety. And I usually answer those questions together, which is, how safe is laser? And to put this in context, after 1 year of daily use contact lens wear, you are at a significantly higher risk of a serious infection compared to one-off laser surgery. So if you're asking, if you know people who wear contact lenses, you know people who wear contact lenses, they are at higher risk, they're putting their eyes at higher risk after just 1 year. So obviously as the years go on, the risk gets even higher.
A lot of money for this. Will it wear off? How do you know? What you were saying something about the two different types?
So laser, like I said, you can kind of divide it into stages of life. So the typical patient that we have in coming for laser are younger patients, say in their 20s and 30s, and they are not presbyopic yet, i.e.,
yes,
as long as they have their contact lenses or glasses in, they can see distance and near. When we laser them, we can typically tell them that this surgery will last up until the next stage of your life, your 40s and 50s, where you will start to lose the reading vision. So we tell them we can do another laser procedure in one, as I described before,
yes,
to give you the near vision. And you can expect that to last up until the lens starts to change, where you develop the lens opacity or the cataract, where we can do a lens surgery and that lens will sit in the eye for the rest of your life. There can be changes in the prescription that would happen anyway, and then we can carry out an enhancement at any part of that journey to change or to correct any small prescriptions creeping back.
Yeah. Thank you very much indeed for the consultation. That was fascinating, and I think we have busted a few myths there.
I hope so. I
laser eye
do
surgery.
hope so, yes. Thanks for asking the questions.
Thank you.
Yes.